respond aggressively in this pandemic and in this crisis. So, Mr. Mayor, thank you very much for your leadership and for the collaboration that we have had throughout. Thank you, Governor.
Great. All right. Well, appreciate all your hard work. All right, Don, you want to make some comments?
Sure. First, I'd like to thank Governor DeSantis, Lieutenant Governor Nunes, the mayor, as well as Secretary Mayhew for supporting this project. So Jackson facilities do have capacity at this point. Our biggest challenge is staffing. And with the addition of these 100 nurses, this will help us to continue to grow the census if needed from a safety perspective. And then also what it does is it allows our nurses right now that have been on the front lines since March to have some additional relief and some additional assistance. When you take a look at what we're doing here, there's 100 nurses that will be starting over the next few days. 75% of those will be critically care trained. We will be able to start treating patients within a week. We need to make sure that we orient the nursing staff to Jackson practices and also look at their competency. At the same time, what we've been doing is we've been doing our own hiring. We've hired close to 100 nurses that will start between now and the next month, and those nurses obviously have jobs, they'll need to give notice, et cetera, and we'll need to get them into training. So from a capacity perspective, we think this is the right thing to do. This will move us to the next level. I also wanted to make sure that everyone was aware that the most important point, I think, of today is what the governor and what the mayor has indicated. Every member of the community needs to go ahead and make sure that they're wearing a mask, staying 6 feet apart, and frequently washing their hands. That will prevent hospitalizations and people coming into the emergency rooms throughout the county on that. I'd like to just share some other statistics. One, I'd like to thank Secretary Mayhew on that effort for our former rehab hospital being converted over. On any given day, we have 30 to 40 COVID-positive patients there that would have been in the hospital that we were able to now use that space for acute care patients. Today at Jackson, we have 345 patients as of 8 a.m. today. 25% of those are in the ICU. About 20% of the current inpatients are under 50, which that number, has grown. More than half of the current inpatients are under the age of 65. And to the governor's point, between 30 and 40% on any given day, these are patients that are coincidentally COVID that have come in for something else, a broken leg, a trauma accident, et cetera, that have tested positive. We do have plenty of vent capacity. That's not an issue. We're only using about a third of our ventilators that we have in stock. And so with that, I'd like to thank everyone again. This will be a great additive to our staffing.
Thank you. All right, Kim from Avante, do you want to talk about some of the things you guys are doing here?
Sure. Thank you, Governor. First, I wanted to say thank you to Governor the state of Florida, Secretary Mayhew, the Agency for Healthcare Administration, on behalf of all of us at the Avante Group, for your ongoing support to long-term care. All of your efforts and your resources have been invaluable to us as an organization and as an industry as a whole. So thank you guys so very much for that. At Avante, our mission statement is simply put, our mission is you. And when we opened this facility, that was the forefront of why we opened this facility. Simply put, our mission is you, the community of Miami-Dade, the residents, the families, and getting these folks a place to go that is safe, provide relief to the hospitals, release some of that capacity from the hospital to the nursing home setting, we have hired some of the most dedicated, compassionate staff in this facility that are all dedicated to the quality of care and outcomes of these residents that we have that have admitted so far and will continue to admit to the facility in the near future. Our goal is to get them better, get them back into their previous discharge setting, and provide them with our values and our standards as a company, that we provide quality outcomes and quality care to these residents. We've put in place stringent infection control policies and procedures in accordance with CDC, the Department of Health, and the Agency for Healthcare Administration to ensure that our residents are getting the most up-to-date, most current care, most current infection control practices provided to them while they're in this facility in order to have a successful discharge back to the community or their long-term care facility that they came from. So we are honored to take on this project. We are proud to support the hospitals and the community of Miami-Dade, and we look forward to this continued partnership. So thank you, guys.
Great, and thank you for what you guys are doing. I think this helps. You know, one thing, when you're talking about discharging these patients, I mean, one of the reasons why you kind of need this is we have the rule